Hello everyone, and welcome back to the channel. I'm Dr. Zara, and today we're talking about a topic that is deeply important to the health and confidence of so many men, especially as they cross that incredible milestone of 50, achieving and maintaining stronger, more reliable erections naturally. In my practice, I hear it all the time. Men come in, they're feeling great about their life, their career, their family. But then the bedroom starts to feel like a place of anxiety instead of connection. It's a completely normal part of aging, but it's one we can absolutely address. It's not a sentence, it's a sign that your body needs a little bit more attention to its circulation, to its hormones, and to its overall wellness. Now, before we get into the specific remedy I want to share with you today, and yes, it involves that incredible age-old tonic castor oil, I want to be crystal clear. When you start experiencing difficulties with achieving or maintaining an erection, the very first step is to see your doctor. Why? Because the vascular system that feeds your heart is the exact same system that feeds your other vital organ. Issues down below can be an early warning signal for conditions like heart disease, high blood pressure, or diabetes. We need to rule out or manage any serious underlying health issues first. Okay, now that we've got that crucial point out of the way, let's talk about natural support. So many men are looking for ways to enhance their vitality without immediately jumping to pharmaceutical options. And there are wonderful time-tested natural ingredients that can help primarily by improving one key thing: blood flow. An erection at its core is simply a hydraulic event. It's all about getting a strong, steady surge of blood into the penile tissue and keeping it there. This is where the power of natural topical remedies comes into play, and specifically the technique of targeted massage using castor oil. Castor oil derived from the castor bean has been used for centuries across different cultures, primarily known for its potent anti-inflammatory properties. Its power lies in a unique fatty acid called rice oleic acid. This compound is a known circulatory stimulant. When applied topically and massaged into the skin, it can help encourage localized blood flow, reduce tension, and combat stagnation. Now I know what you're thinking. Rub castor oil where? Doctor, the key spot we're going to focus on is not the organ itself, but an incredibly important area linked to your circulation and pelvic health. The spot is the perineum. For those who may not be familiar with the term, the perineum is that patch of skin and underlying muscle located between the anus and the base of the scrotum. It's a critical crossroads for the blood vessels and nerves that control erectile function, particularly the pudendal nerve and the arteries that supply blood to the penis. These deep pelvic floor muscles, which this area overlies, are essential for both erection rigidity and for preventing blood from leaving too quickly. Think of it this way. If the blood flow is the fuel, the pelvic floor muscles and the surrounding circulation in the perineal area are the engine and the pipeline. If that pipeline is constricted, tense, or inflamed, the fuel can't get where it needs to go efficiently. Here is the simple yet profound technique: the castor oil perineal massage. You'll want to make sure you use a high-quality cold-rest, hexane-free castor oil. The quality matters when you're talking about absorption into your skin. Before bed is often the best time to do this, as it allows the oil to work its magic overnight, and it also fits nicely into a relaxing nighttime ritual. Step 1. Get comfortable. You can do this lying on your back with your knees bent or sitting with a slight forward lean. Step 2. Take a small amount of the castor oil, a teaspoon, maybe a little more depending on your comfort. Remember, Castor oil is thick, so a little goes a long way. Step 3. Gently apply the oil to the perineal area. Step 4. Begin a slow, deep circular massage. Use gentle but firm pressure. Your goal is not to irritate the skin, but to stimulate the deep circulation. Spend a full minute or two just getting the oil absorbed and the area warmed up. Step 5. You can move into a more targeted pressure. Using your fingertips or the heel of your hand, apply pressure moving forward from the base of the anus towards the scrotum. Do this motion slowly, counting to 5 for each forward stroke for another few minutes. This directional massage is specifically designed to follow the path of some of those vital vessels. Now, as you're massaging this area, you are not just applying oil, you are engaging in
mindful physical therapy for your pelvic health. You are easing tension in the pelvic floor, and you are using the rosenic acid to encourage that all-important nitric oxide production, which is what signals your blood vessels to relax and open up. The principle of combining castor oil with essential oils is where we move from a simple remedy to a synergistic therapy. Remember, the goal of the perineal massage is to stimulate circulation and reduce localized tension and inflammation in a key area for erectile function. Castor oil is our powerful, deep penetrating base thanks to its unique renoleic acid. But we can dramatically amplify its effects with the right aromatic allies. As I've mentioned, you must perform a small patch test before using any essential oil, especially in a sensitive area. Dilution is non-negotiable. Essential oils are far too potent to be used directly on the skin. Your cold-pressed castor oil acts as the perfect viscous carrier, amplifying the massage with essential oils. My primary recommendation for an added circulatory boost is cinnamon bark essential oil. The mechanism of action here is fascinating. Cinnamon contains a compound called cinnamaldehyde, which has a well-documented vasodilating effect. It means it actively encourages your blood vessels to widen or relax, which is the foundational action needed for a firm erection. When you feel that gentle, localized warmth during the massage, that's the oil helping to open up those minute capillaries and arteries, boosting the flow of oxygenated blood. Just 1 or 2 drops in your teaspoon of castor oil is the ideal therapeutic concentration. We want stimulation, not irritation. Consistent use helps relax the smooth muscle tissue in the arterial walls over time, improving the capacity for blood flow to the area. Another exceptional choice is rosemary essential oil. And here we are targeting 2 aspects of erectile
health. First, its high antioxidant content helps protect the delicate endothelial cells that line your blood vessels from inflammatory damage, which is a major contributor to age-related circulatory issues. Second, rosemary has a traditional use in stimulating nerve pathways. Since an erection begins with a strong neurological signal from the brain, supporting healthy nerve function in the pelvic area is a brilliant way to enhance the effectiveness of your routine. Again, limit yourself to 2 drops mixed thoroughly with the castor oil base. A third powerful option, which I also encourage men to explore, is ginger essential oil. Ginger is a true powerhouse for circulation, renowned for its ability to generate a powerful internal heat. In a topical application like this, it can feel more invigorating than cinnamon, driving blood flow to the deepest layers of the pelvic floor musculature. Furthermore, ginger contains active compounds known to reduce overall inflammation, which is key to long-term vascular health. As with the others, 1 to 2 drops is all you need. Always listen to your body. If the warming sensation feels too intense, simply use 1 drop next time. The entire ritual, from the moment you apply the oil to the last gentle stroke of the massage, should take you no more than 5 to 7 minutes, but the profound benefit lies in its consistency and the deep relaxation it induces. I always encourage my patients to incorporate mindful breathing during this time. Slow, deep, deliberate breaths that engage the diaphragm. This intentionally shifts your body into a parasympathetic state, the rest and digest mode, which is the only state in which sexual arousal and function can truly thrive. You are not only physically stimulating circulation, but also psychologically resetting your system, training your body to be relaxed and responsive. This topical therapy, however, is truly only the starting line. Lasting improvement in erectile strength, especially for men over 50, is fundamentally a product of your internal environment. The health of your blood flow, the balance of your hormones, and your body's overall inflammatory load are constantly dictated by your diet, exercise, and lifestyle choices. The castor oil is a fantastic local intervention, but the true battle for enduring vitality is won or lost based on what you put into your system and the self-care you commit to every single day. We must address the systemic issues that cause that blood flow stagnation in the first place. So, let's talk about 3 key pillars that you absolutely must integrate alongside your nightly castor oil routine. Pillar 1. Nitric oxide boosters. Nitric oxide is the molecule of erection. It's the signaling molecule that tells the arteries in the penis to widen and allow the blood to rush in. As we age, our body's natural production of nitric oxide often declines. You can boost this naturally through your diet by focusing on foods high in larginine and L-citrulline, which are precursors to nitric oxide. Think about incorporating more. First, beets and beetroot juice. They are exceptionally rich in natural nitrates, which your body converts directly into nitric oxide. A daily glass of beetroot juice is one of the most powerful natural supplements you can take for vascular health. Second, watermelon. It contains a significant amount of L-citrulline. This amino acid is converted to arginine in the kidneys, providing a slow-release sustained source of nitric oxide production. And third, dark leafy greens like spinach and arugula. Just like beets, they are loaded with nitrates. Making a spinach salad a regular part of your dinner is a delicious and effortless way to support your system. Pillar 2. Pelvic floor strength. I mentioned the pelvic floor muscles being the engine of the erection. Well, a weak engine doesn't win the race. These muscles, often called the puboxeus or PC muscles, are what you contract to stop the flow of urine. Strengthening them is crucial. You need to do your Keely exercises. I know many men think of Keel as only for women, but that is simply not true. Strong PC muscles help compress the veins that normally allow blood to drain from the penis, thereby trapping the blood and making the erection firmer and last longer. You can do these anywhere, sitting at your desk, driving in your car, or while watching this video. The technique is simple. Squeeze those muscles, hold for 5 to 10 seconds, and then fully relax. Do 3 sets of 10 repetitions 3 times a day. Consistency here is everything. You are essentially building a natural internal support band for your erections. Pillar 3. The anti-inflammatory lifestyle. Erectile dysfunction is often a disease of the blood vessels, and blood vessel disease is often a disease of chronic low-grade inflammation. To truly fix the problem, we must fight the fire of inflammation in your body. This is where your lifestyle choices become your most powerful medicine. First, movement. You must engage in regular vigorous cardiovascular exercise. Think brisk walking, jogging, cycling, or swimming for at least 30 minutes most days of the week. This type of exercise is a proven non-negotiable remedy for erectile health. It strengthens your heart, improves blood flow to every part of your body, and helps reduce systemic inflammation. Second, fat composition. Specifically the kind of fat you eat. Focus on healthy essential fatty acids. Omega-3s found in fatty fish like salmon or in flax and walnuts are potent natural anti-inflammatories. Third, managing stress. Stress and anxiety are silent erection killers. They flood your body with cortisol, which redirects blood flow away from non-essential functions like sexual arousal. This is why I recommend incorporating a short session of deep diaphragmatic breathing or meditation right after your castor oil massage. Just 5 minutes of focused, slow breathing can shift your nervous system from fight or flight into rest and digest. The state where sexual function is naturally supported. This journey we're on together, my friends, is not about finding a magic pill or a quick momentary fix. That's simply not how the human body works. This is about making a fundamental lifestyle shift, and I promise you, it is one of the most powerful and rewarding commitments you can make to your health. The nightly castor oil perineal massage, whether you use the oil pure or supercharge it with a couple of drops of cinnamon or rosemary essential oil for that targeted circulatory boost, is a brilliant way to provide localized direct support to the vascular and muscular structures in your pelvic region. It's an act of self-care that acknowledges and nurtures the source of your masculine vitality. However, the strength you build beneath the surface is just as critical. We must continue to support that internal environment that is so vital to healthy erections and overall wellness. Remember our 3 internal pillars that create the foundation for strong, reliable function. Firstly, you have to fuel your system to create the raw material for that hydraulic pressure. This means deliberately increasing your intake of nitric oxide boosters. Make those bright red and green foods your friends. Lean into the natural nitrates found in beets and beetroot juice, and enjoy the L-citrulline rich goodness of watermelon. These aren't just trendy superfoods. They are nature's own vasodilators, helping to signal those blood vessels to relax, open up, and deliver that vital blood surge. Secondly, you need to strengthen the engine, and that means making keel exercises a non-negotiable part of your daily routine. Think of your pelvic floor muscles as the gatekeepers of your erection. They not only contribute to the initial rigidity, but are absolutely essential for maintaining the firmness by preventing the rapid outflow of blood. A strong engine runs smoother and holds pressure longer. Consistent practice. Those quick squeezes and holds will noticeably enhance your control and resilience over time. And thirdly, we must continually fight inflammation from the inside out. Systemic inflammation is the silent saboteur of your vascular health. Your blood vessels can't function optimally when they're constantly under attack. This is where your daily cardiovascular exercise comes in. Getting your heart rate up, whether through a brisk walk, a run, or a swim, is medicine for your entire circulatory system. Pair that cardio with a consistent intake of healthy fats, particularly omega-3 fatty acids from sources like fatty fish, flax, seeds, or high-quality supplements. This integrated approach is the comprehensive natural plan for men over 50 to truly take back control of their vitality. This is about so much more than just a fleeting physical performance. It's about your health, your fundamental confidence, and maintaining a vital, connected life with your partner. You deserve to feel strong and capable at every age. Be patient with your progress. Be consistent with your ritual and honor your body by giving it this dedicated self-care. If you found this information insightful and empowering, please take a moment to hit that like button and subscribe to the channel for more health wisdom. And I genuinely love hearing from our community. So drop a comment below and tell me, what are your own favorite natural health rituals that keep you feeling strong and energized? I'm Dr. Zara, and I'll see you in the next video. Stay healthy.